And a lot of people are wondering how certain drugs might interact with the COVID-19 vaccines. Doctors say timing might be important. Our ABC 10 News anchor Derek Stahl is going in depth on the science behind the recommendations.
People who are about to get the COVID-19 vaccine are told to expect some mild side effects. 70% report pain or soreness at the injection site. Roughly 1 in 3 experience fatigue or a headache. So it might be tempting to take some pain medication like Tylenol or Advil before the shot. But hold on.
If you had a choice, I wouldn't take it before, I'll take it after.
That's because some over-the-counter pain meds work by blocking chemicals in your body called prostaglandins. Prostaglandins cause those flu-like feelings, but they also have an important job.
It's like a bugle horn.
UCSF infectious disease expert Dr. Peter Chin-Hong says prostaglandins summon immune cells.
So they're like the bugle calling out on the battlefield to say, hey, troops, come. So the idea is if you make the volume softer, maybe not as many troops will come to the battlefield.
By fewer troops, he means fewer antibodies. But he notes it's more of a medical theory than a fact. One study found mice that were given ibuprofen produced fewer antibodies against the coronavirus. Ibuprofen is the active ingredient in Advil and Motrin. In humans, the data is mixed.
There was one clinical trial that did involve a preemptive acetaminophen, and that was the Oxford AstraZeneca trial. And it didn't seem to make really much of a difference in terms of the immune response or not.
Dr. Christian Ramers of Family Health Centers of San Diego says studies from before the pandemic suggest preemptive pain meds might make a difference, but the evidence is thin. A 2016 study found kids who took pain medication before getting a vaccine produced fewer antibodies, but a larger study found it didn't really make a difference.
The evidence isn't conclusive at this point.
Dr. Chin-Hong says you should get the shot first, then try simple remedies if you have pain, like a warm towel or moving your arm around. If that doesn't work, he says it's okay to reach for the pain meds.
After the shot, the immune system's already been there and mobilized, so you're not going to make it mobilized less.
If you want to be extra careful, consider the brand. Ibuprofen-based drugs like Advil and Motrin affect prostaglandins the most, so you might be better off with an acetaminophen drug like Tylenol, although experts say it's just an educated guess. Derek Stahl, ABC 10 News.
And even though the CDC recommends that people avoid pain medications before getting the vaccine, doctors say people who regularly take the drugs for chronic conditions like arthritis should stick to their regular routine.